should be looked at because if it's low, it can be
Mm.
easily replaced with a very small amount of progesterone. So I
Maybe you
think
just want
hormonal
to
health
stop
becomes
there and
critical.
unpack pre-testosterone in women because it's a very complicated, test to look at and optimize it just because of the just changes in hormones. But, per volume, women have more free, testosterone than actually estrogen. People don't know that out there.
Right, exactly.
And then they don't look at testosterone. So maybe look at maybe how you assess free testosterone in women.
I think that you really have to, acknowledge that testosterone, you're right. Why do we have even more of that than estrogens? Because it's critical to our bone health. It's critical to our mental health. It's critical to libido. We know that muscle is the currency of longevity. You need a lot of muscle mass. And if you don't have high enough testosterone, you're not going to be able to form muscle mass. I don't care how much you go to the gym and lift weights. So testosterone is actually really, really important. And we can replace it if it's low. And again, one of the overlooked things when you look at, for instance, birth control pills or women who are on just estrogen replacement. Well, if you're on estrogen replacement or birth control pills, which are very high estrogens will increase sex hormone binding globulin. Sex hormone binding globulin binds testosterone, makes it unavailable. So you have to look at the free testosterone. And any woman on birth control pills is going to have a low free testosterone. So that's why sometimes libido can be affected, things like that when people are on birth control pills. And that gets really overlooked in women. You have to look at that. Again, even hormone replacement, lots of times as you sort of start altering that, you start pumping up the estrogen in women as they're getting perimenopausal, you're going to start actually lowering the testosterone because of the sex hormone binding globulin. So you have to actually keep those things in mind and keep those ratios really optimal. It gets so overlooked in women, honestly.
Yeah, absolutely.
It's funny. I put one of my women on testosterone who was having a surgery, and I said, you need optimal testosterone to recover from your surgery. And her doctor was like, why? You're a female. You don't need testosterone. So, so
Yeah,
it's
it's
really,
crazy.
there's so much sort of negativity to testosterone women, and it can be hugely
Mm.
beneficial.
So, just while we stop here, before we go just to a few more labs, and then I want to look at sort of cardiac scans because I think that's important, the CAC scan and the clearly
Yeah, yeah.
scan. But in terms of using peptides to optimize these hormones, is that something that's a first port of call from you, or are you looking at DHEA or a 7-keto DHEA? This is a minefield, and even within functional medicine sort of docs, they've got different protocols, and I think that's what confuses. I see someone and someone's been on this and been on that, and then it's tricky. Then someone says, "Oh, they gave me TRT because they make more money," and so it's very tricky. Never mind, we've had a young doctor, 49 here, a Dr. Mark, they called him Mr. T at 49, pass away, and a couple of guys in the US I know with very high testosterone levels, and then fibrinogen and D-dimer tests increased, and not looking at a few things. This has to be, managed and monitored.
Right. We don't, super physiologic levels of testosterone are not good, right? We do know that testosterone actually is, they just removed the black box warning off of it that it caused cardiac issues. It does not. But super physiologic doses, dosing to the bodybuilder level of testosterone can, as you said, affect things that that do worsen cardiac health. And I was this conference, the hormone conference I was just at. There was a cardiologist who was presenting a case that actually showed a guy who his cardiac scans, his coronary CT scans prior, and then he was dosing testosterone very, very high, 3 times what would be considered sort of a normal testosterone. And he showed his cardiac scan a year later, and he had considerable worsening of plaque. And
Mm,
so we do know that there is issues with super physiologic doses of anything. Our body is designed for optimization, not super
yeah.
physiologic dosing.